slightly. And percussion in this position should be done in four directions, from the umbilicus to epigastric region, from the umbilicus to suprapubis region, and from umbilicus to left and right side. Normally we should hear tympanic sound, dull sound, or dull sound. Then patient should turn in left and right side. Please turn in the right side, and we should do percussion in level of umbilicus from up, upper part of abdomen to down. Same. Sound should change. If patient has a fluid, in horizontal position we will find a dull sound in lateral sides. In lateral position we will find level of fluid in lower part of the abdomen. There are two kinds of the palpation. You should control patient position first of all. And patient should be without control. Patient should not cross legs.
Should not.
Sometimes to relieve palpation, patient can lift a little knee, but it's not important. If you cannot palpate something, you can do it. Head part of the bed should be direct with other part. It should not be lifted. All these points is a mistake during exam. You should control it. Two methods of the palpation: surface and deep abdominal palpation. Surface palpation is oriented palpation. We can use it like an orienteer to find pain, to find condition of the muscles, some tumor, hernias, edema of the skin. You should know. But, okay, a little good, but if it will rise more, it will mistake. Two methods of the surface palpation: by round and by symmetrical points. To select methodic, you should ask patient about presence of pain. Have you pain somewhere in the abdomen? No pain. If patient haven't any pain, we should do palpation by round. We should start from left inguinal region, left gland, left hypochondrium, left epigastric region, right hypochondrium, right gland, right inguinal region, and from epigastric region to umbilical region and suprapubis region. You should palpate by your finger. And we should ask patient about appearance of pain. Had you pain during palpation? No pain. If you feel contraction of the muscles during palpation, it can be due to resistance or rigidity of the muscles. To differentiate it, if you feel construction of the muscles just in time of palpation, it is a resistance of the muscle. It is a sign of local inflammation of the abdominal wall, local peritonitis. If you feel constructed muscles all the time, it is a rigidity of the abdominal wall. It is a sign of peritonitis. If patient feel pain, we should select other method. It is a symmetrical palpation. For example, our patient feel pain in this area. We should start palpation in maximum distance from this area. We should start from left inguinal region and palpate left, right, left, right, left, right, and ask patient about pain. had your pain. After this, from up to down. In this palpation, last point of palpation is painful area. If we will start from painful area, patient will feel pain anywhere. That's why it should be last point of palpation. If patient feel pain in this place, we will start from this point. 1, 2, 3, 4, 5, 6, last point, and from up to down. After surface palpation, we can start deep abdominal palpation. There are a lot of practical skills during exam about deep abdominal palpation. Before every skill, you should do surface palpation. First question is sigmoid colon and descending colon palpation. Before this, you should do surface palpation, and after this, you can start deep abdominal palpation of this point. You should do 4 movies. First movie, you should place your hand in needed position. First one point of sigmoid colon, you should find distance between spina iliaca and superior and umbilicus. Divide this distance in 3 times and put your hand between lateral and medial part of the abdomen. You should put your hand in 90-degree angle to this line. Second one movie, you should do skin fold. If you palpate something lower than umbilicus, you should do skin fold in to umbilicus. You should do this skin fold. Next, you should do 3 to 4 movies in deep. To do it, patient should breathe by abdomen, and during inhale, you wait. During exhale, you put your hand inside of abdomen and fixate it. Last one movie, it is slide movie. You return your hand, and during this movie, you can feel colon. First movie, skin fold, need you to do last one movie. If you will not do skin fold, you will not able to do good slide movie. That's why you should do very nice skin fold before. Let's say show you. Sigmoid colon is breathe by abdomen. During inhale, we do skin fold. During exhale, we go in deep. Breathe by abdomen. You should enlarge your abdomen during inhale. Again. During inhale. Now you enlarge your chest. You should enlarge your abdomen. Now. No. When you breathe, you should relax chest muscles and construct diaphragm. You should breathe to lift my hand during inhale. Yeah, like this. First one, skin fold, moving in deep.
4 months plan. 5.
In deep.
6.
In deep. In deep and slide. And during this palpation, we can feel elastic tube of the sigmoid colon. It can be a little movable. Sigmoid colon practically unmovable, without any pain, without or with bubbling. We can hear bubbling during palpation. Next one point is descending colon. Sigmoid colon places here. Distended colon connect with sigmoid colon. We should put our hand in the left flank, in line of sigmoid colon. It is in level of umbilicus. Patient breathes by bimanual palpation. Under this part of abdomen, patient haven't any bowels. And to fixate the standing colon, we need use our left hand to compress abdominal wall. And when we will do, we will need to
Insert it.
to put our right hand closer to left hand, and after this we will slide like this. Please breathe.
From abdomen?
Yeah, by abdomen. Skin folds and move it in deep. In deep.
بيعرف مع الكورونا؟ لا.
In deep and slide. Okay. It's palpable. Next one part of colon which we can palpate, it is a cecum. Symmetrical point, distance between spine iliac and umbilicus divided by 3 times, and put our hand between medial and lateral part. Patient breathes by abdomen, skin fold to umbilicus, and move it in deep. Да. Может быть, видео Немцова на ДО есть? Let's do it again. Second, breathe by abdomen, relax your hands, skin fold, move it in deep. Deeper. Don't joke, please.
You told me like I am pregnant.
Pregnant woman cannot breathe by abdomen. It's too difficult. In deep. Deeper. Deeper and slide. Next one part is ascending colon. Manual palpation. We should compress patient abdomen. Relax your back. It's connected with cecum. Right flank. First move it to umbilicus. 3-4 moves in deep and slide down. Breathe by abdomen. In deep. Deeper. Deeper and slide. Next one part, we should palpate stomach. To palpate stomach, we should do it in same movies, but we should not go in deep. Just one time we should go in deep. We should start from epigastric region, make the skin fold up, then in deep and down. If we will not palpate it from the first time, we should change position of our hand in 2 centimeters below, and repeat it before we will find stomach bottom. Please breathe by abdomen, skin fold, in deep and down. I didn't feel anything. 2 centimeters below. Breathe. Skin fold, deep and down. No border. Breathe. Skin fold, deep and down. And I feel the border. It's placed here. This border of the abdomen. Have you stethoscope, someone?
Yes.
If you have stethoscope, there is also one method to find border. auscultative percussion to find body of the stomach. You will need check differences of the sound. I will do the movie, you will auscultate. When sound will change, you should stop my hand. You should say stop, okay? Put stethoscope in this place.
This side is okay.
Yeah, and auscultate. Breathe normal.
This, this.
Yeah, and auscultate. When sound will change, you should stop. This one, border of the stomach. Put it stethoscope, and we can find other one borders. Stop. And this one, borders of the stomach. Big curvature of the stomach, that's all. This one, method of auscultative percussion to find border of the stomach. Using this method we can find border, put our hand in this place and palpate stomach in one movie. In the exam, it is two different questions, stomach palpation and auscultative percussion of the stomach. That's why if you will have question palpation of the stomach, you should ask patient about presence of pain, make surface palpation and palpate stomach before you will find stomach body. If you will have question of auscultative percussion of the stomach, you should place stethoscope and find the body. Next one point of palpation is pyloric part of the stomach. To find it, we should find line which 3 to 5 centimeters higher than umbilicus, and put our hand in 45 degrees to this line. Patient breathes by abdomen. First movie, skin fold up, and 3 to 4 movies in deep breathe. And slide down, and we can palpate pyloric part of the stomach in this place. It's palpable. Next one is palpation of the transversal column. This palpation be manually. Transversal column and big curvature of the stomach has same mesenterium. That's why to find transversal colon, we should find big curvature of the stomach first of all. We did it before, it placed it here. Then we should go 5 centimeters down from this line and put our two hands in this line in the flank. Patient breathes by abdomen. First movie, skin fold up, and 3 to 4 movies in deep breathing. Else one time deeper and go down. From this side I palpated, from this side I didn't feel anything. And else one part of the abdomen, it is terminal part of the ileus. To find terminal part of the ileus, we need make line between two spina iliaca and divide this line in 3 parts and put our hand in 45 degrees to umbilicus line. Patient breathes by abdomen, please breathe. Skin fold to the umbilicus and go in deep. Deeper. Deeper. Okay, relax. Deeper and slide down. Why we can palpate terminal part of ileus, but we cannot palpate other parts of the intestine? Why? As you say.
The question again.
Yeah.
Percussion
The
is,
question again.
We can palpate colon. We can palpate terminal part of ileus. Why we cannot palpate other parts of the intestine?
because they move.
Because
They're small and they move. Easily move.
It is movable. Colon has very short mesenterium. Cecum, sigmoid colon, has about 2 centimeters of mesenterium. It's practically unmovable. Ascending and descending colon can be movable in 5 centimeters. But when you will move it, you will find point of fixation and you will palpate it. Mesenterium of ileum and other part of intestine very long. It is about 20, 30, 40 centimeters. And when you will move intestine, you will not find point of fixation. That's why we cannot palpate it. Terminal part of ileus connect with cecum. And that's why this part fixated in same place every time. And due to presence of point of fixation, due to short mesenterium, it is practically unmovable. We can palpate it. Other parts really movable, that's why we cannot palpate. Let's try to do it. Girls, who has a short nails? If you have long nails, you cannot palpate abdomen.
why patients breathe always?
Why patients should breathe by abdomen? When patients enlarge abdomen and then make it exhale, patients remove everything from the abdomen and we can do moving indeed. If patient breathes by chest, during exhale, patient will not relax abdomen and we will not able to go indeed. Who has a short nails, you can try to palpate something.